Hey Sherleen, how are you doing? Welcome.
Hi, doctor. I'm doing great. How are you?
Great. How is your husband and kid doing?
Yeah, they're doing great. Thank you.
Lovely. So, I was so surprised and so happy to see your pictures which you sent a couple of days back after your mommy makeover procedure, which we did a couple of years ago.
Yep.
Yeah. So,
Yeah.
how has been your journey since then?
After the surgery,
Yeah.
um, amazing. Just a lot of confidence. I love the way that I look. I love the way that it makes me feel. Yeah, the best thing I've ever done for myself. So
Yeah.
yeah, it's been.
Yeah. So that picture which you sent us, it felt reflected the confidence of you wearing a bikini on the beach. So it was such a nice picture. It showed and it made us happy that that's many people think that cosmetic surgery is just about beauty. It's it's much more than just the outside beauty. It's about how it makes you feel from within inside, isn't it?
Of course, yeah. I mean, like, um, there's so much stuff I've done that I haven't been confident in doing prior to the surgery. I mean, like, um, I also did a boudoir shoot for myself,
Oh, nice.
which was for me, and yeah, to be able to do that and to feel sexy and beautiful and um, just positive and amazing. There's no feeling like it. Like I would never have thought to do that prior to the surgery, but to be able to do that and other things as well, it was amazing. Yeah.
I'm so happy for you. So let's go back to your journey. You came to us a couple of years back, and just for our audience, if you can tell us what all procedures you wanted and how did we go about it?
Sure. So basically, I wanted to get the tummy tuck. I got a BBL, breast lift with implants, arm lifts, and also liposuction.
Yeah, so we did your 360 liposuction, buttock augmentation because we are moving the fat, and buttock augmentation and the hip dip correction would give you a nice silhouette. And then we did your breast lift, and we also did your arm liposuction with a short scar arm lift. Uh, so, and of course, since these were multiple procedures, we broke it down to two sessions, I remember. And because doing clinically, I think doing all these surgeries in a single day, it's not safe. We want our patients to recover smoothly and not do everything together. What do you think about it?
I agree, 100%. I mean, if you're getting so many things done, it's best to break it down and do it in parts because the recovery is intense in itself, and your body needs that time
Absolutely.
to adjust. So if you're going to do everything all at once, you're putting yourself at risk, and it's not worth it. If your doctor recommends, like you said, like you recommended me to do it in two parts, listen. Yeah.
Yeah. Sometimes the patient gets upset with us. Oh, doc, it will make my trip longer. I can't break it down to 2 parts. I don't have time. But I put my foot down. No, this is what is right, and I'll not do something which is I don't think it is right. So,
Well, you
and
are a
sorry.
matter expert. I said you are the subject matter expert in this, so um, yeah, I mean you know best. So definitely listen to your.
So, Charlene, just tell us about your journey. How did you stumble upon us living in Sydney? Me, I am in Delhi. My practice is in Delhi. How did you, in the whole world, came to us?
To be honest, we were my husband and I. We found you on Google, and we decided to come to India mainly because, well, my husband is from Delhi, so he can speak the language. He's familiar with the place. So we were a lot comfortable coming to Delhi. So we decided to do a Google search, and you popped up. And then when we had a look at your Instagram and saw all these people that have come from abroad and they have amazing results and they had such an amazing experience with you and your team, it was hard not to connect with you.
Yeah. So yes, you had your husband. Most of our patients even travel alone from abroad. 60% of my practice is international patients. Uh, so if you think your husband would not have been there traveling with you, you would have been traveling alone, or he would not have been from Delhi, India. How difficult or easy was it to would it be to travel to India with my team, taking care, connecting with you? Because this is just to, maybe some of our audience want to travel to India and they may think, oh, I don't know anyone there. So what do you think about that?
Well, I mean, yes, it is daunting coming from an abroad place, and if you don't know India, never been there, yes, it can be quite daunting. But what is quite reassuring is the team is we can connect with your team very easily. I mean, as soon as I sent out an inquiry, I think maybe a couple of hours later, I got a response.
Yeah.
And prior to even traveling to India, the amount of times you and I spoke
Mm.
and got in touch, it was very easy. And knowing that if I was to come alone, I know that your team would take care of me.
Yeah.
If I transport, if I needed to know where I could stay,
Yeah.
um, those sort of things, I know that you and your team would look after me. So very easy to connect with it, and that's the main thing for anyone traveling overseas.
Yeah, absolutely. See, my team is ingrained in the sense that it's in their DNA. They think like if anybody is coming from abroad, we are not just their healthcare provider, we are also their local guardian during their stay in India. So that's the kind of thought process we have, so that the patient overall experience, and not just in hospital, even beyond hospital, right? If they have issue with the hotel where they are staying, any problem, with the cab, food. So they try and connect with each patient at any point of time if they need any help. So yeah, so that's the kind of I'm blessed to have such a nice team in that sense. Um, I also want to know what has been your experience with your results. You know, I saw a great shape of your abdomen. If you can just bring out to our audience who is watching this interview with you, how much the shape has improved, and what it makes you look now.
Wow, the results and the shape are amazing. Like I can't even remember the last time I had an hourglass shape. I
Hmm.
can't even remember seeing my abs like back when I was in high. I was playing tennis regularly. Probably when the last time I remember when I could actually see my abs. That's amazing. Like I feel like I'm 21. No, it's been great. Like the shape, everything what I wanted, what I visioned, I got. So yeah,
Lovely.
very happy.
I'm glad that we could make you happy. Um, how has been your recovery? How was your experience with in our ward while you were in the hospital? You were in the hospital two times because we did your surgery in two sessions. So how was your aftercare in the hospital? Sometimes patients think that they are in so-called developed countries like Americas or Australias or UK, and they sometimes may not imagine what kind of healthcare do we have in India. So what was the experience, overall experience in our hospital with our nurses?
It was fantastic. As soon as I came out of surgery, the way they attended to me, if I needed anything, they were right there. It was very easy to communicate with them as well. They were absolutely brilliant. Like I felt like I was their daughter, and they were taking care of me like I was sick. They were just lovely. Like an absolute amazing team.
So
Very good.
yeah, I'm so happy to hear this. I'm sure my nurses, when they watch this interview, they will also be very happy. They do take care. They all are very handpicked, and they do care of our patients as each patient is one of their own part of our family. So thank you for saying this for them. Um, any message to people who you think contemplate cosmetic surgery and are contemplating coming to India? Any message to them?
My message to them would be to definitely reach out to yourself. Like do your research, understand exactly what you want, listen to what the doctor says and recommends as well. You are traveling all that way to come and get a surgery like done. So make sure you take the precautions and yeah, ask a lot of questions. Definitely ask a lot of questions, but definitely get in touch with you, doctor.
Thank you. I remember many of your questions. You had a lot of questions as well. So it's always good that for us also, if a patient is well read, researched, and they ask questions, you are able to connect with them at a much more, scientific level. It makes our easy job easy because you've explained to the patient what to expect, how is going to be recovery. So that's always nice to have an educated patient as respect to someone who just comes, oh, just do the surgery, how much will you charge? So it's just not about about the surgery, it's about the whole experience and whether the patient is educated or not. Any message
Yep.
to any message you have for us and our team?
Yeah, I mean, like it's great. It's great connecting with you, doctor, and getting in touch with you again. I do miss the team. I do miss nurses, and Dr. Gautam as
Dr.
well.
Gautam, yes, Dr. Gautam as well, yeah.
I follow him on Instagram as well. Yeah, no, just great, absolutely amazing team. I definitely recommend you and your team. Yeah, keep doing the great job, guys. You guys are smashing it. So
Thank
yeah.
you. um, and when are you coming next to us?
Look, there has been a few conversations with my husband, so
Oh,
don't be
I did not
surprised.
know this. I just asked this randomly.
Um, who knows? I mean, don't be surprised in the near future. There'll be a message saying, "Doctor, I'm thinking of getting something else done." So
I'm always
but
there, happy to help. But you look amazing. Maybe in 20, 30 years, maybe for a facelift. But
yeah, yeah, definitely know you're on my speed dial for
yeah,
that. Don't worry.
thank you.
I do mates that are very impressed with the results, and they are considering doing plastic surgery. So I have told them about you and your team, and when they're ready, they'll be reaching out.
Thank you. Thank you. And I'll be there always to take care of any of your friends, relatives who wants to come. Thank you for doing this, Sherleen, coming online, talking to us like this, giving us an interview so that, people abroad across the globe understand what value we bring and what results our patients can get and what healthcare system in India is. That
Mhm.
is very important. Lovely talking to you always. Give my regards to your husband and love to your kid. A big hug. And please stay in touch.
I will. Thank you, doctor. Thank you for everything.
Thank
Take
you.
care.
Thank you. Bye. Bye. Bye.